Hello everyone, and happy Valentine's Day. Today, in the spirit of the holidays, I'd like to talk about dating and relationships with inflammatory bowel disease, as well as an ostomy. So when you're starting to date with an inflammatory bowel disease like Crohn's or colitis, it's a little bit nerve-wracking because the first question that sometimes pops into your head is, when should I talk to the person about my condition? I recommend not waiting too long to talk about your condition because that's starting the relationship off on the wrong foot. Right away, you're basically sending the signal that you're not going to talk about things completely and that you're willing to hide certain things and not be open about them. I usually recommend within the first 5 dates to probably tell somebody about your condition depending on the situation. Now, if you have scars or an ostomy or something like that, it's going to be a lot harder to hide your situation. So talking about it confidently and openly right from the start will help everything. It'll make it a lot easier when starting a new relationship or discussing it with somebody who you're interested in. So the next question that pops into your mind after you've started the conversation and told the person that you have a condition like Crohn's disease or ulcerative colitis is, how much should I actually tell them? Do I have to get into nitty-gritty of what goes on a day-to-day basis? No. When you're starting off a relationship, discuss the basics. Make sure they understand what the possibilities are and what can go on, but you don't have to get into the day-to-day struggles that you may go through at times. You don't have to talk about how many bowel movements or how much pain you might be on a day-to-day basis or how well you're digesting your food or what things hurt you and things like that. Those are conversations that will come up in time. So cover the basics, make sure they understand what the disease is, that everything might not be perfect at times, but that it won't keep you from having a normal relationship and a normal dating life. So what's going to happen when the person starts to ask questions? They obviously care about you and they've stuck around long enough where they want to see what's going to happen in the relationship, but it's going to be a topic of conversation. There's no way that you can completely hide a disease like Crohn's or ulcerative colitis. I've found in my experience that the best way to discuss your condition is as confident as possible. Make sure that you know what's going on with your body and that you're open with talking about it. If you hide certain things and you try to keep it all to yourself, the person is going to think that it's scarier than it can be and that it's something that you can't overcome as a person. So make sure that you understand that being open and confident about your condition and that it's not going to take over your relationship is something that you can convey to the other person and that they understand. So when starting a relationship with an inflammatory bowel disease, when do you actually want to be physical with this new person or this new relationship that you're starting? It's a little bit tough because you never want to start off things on the wrong foot. So if you're feeling a little bit iffy, if you feel a flare coming on or your body just isn't right, make sure you hold off on this. As we get older and we're all adults, the last thing you want to do is jump into something that you're not ready for. The person that you're with is going to be understanding that it might be a week or 2 weeks or a month until you're ready to be physical with them. Our relationships at this age aren't exactly just the physical attraction and just about, getting into bed and doing certain things. So make sure that you're ready and your partner's ready and that everything's right and healthy at that time. You don't need to just jump in anymore. You want to make sure that the feelings are right and that the person understands exactly what's going on and is also patient with you and your body. If they're not patient with you and your condition and that you're not ready for something, then they're probably not the right person. So take it on your terms, go at your pace, and make sure that they understand that certain things might have to wait due to your inflammatory bowel disease, and you want to start things off on the right foot when you're healthy and when you're feeling completely ready to be physical with them.